In Fox 5 Health News, earlier we told you about that rat infestation in a city-run apartment building in the Bronx. It's not just the sight of these rodents that can be horrifying. Rats actually carry some life-threatening diseases that can be especially harmful to kids.
Joining us now is Dr. Jennifer Caudle, a professor at Rowan University. Good to see you, Doctor.
Good to see you.
The pictures are so upsetting.
They're horrifying.
But I mean, you have to think about the rat dander, the droppings.
That's right, the urine,
and their children were bitten.
Yes.
It's insane.
It's honestly, it's devastating, and it is emotional even to see and to hear about these stories.
Is.
Yeah, and you're right. You mentioned that rats and other rodents can carry diseases. We know that rats can carry over 35 diseases that can occur worldwide, different rats and rodents throughout the world. So that's certainly a concern, as obviously health concerns and diseases and disease transmission. But there are also other things. You mentioned the dander. Some people are simply allergic to rodent dander. There's also the hygiene aspect in someone's apartment in their home, but the psychological aspect too is huge. The anxiety that can come along with knowing that there are rats throughout your home.
And then you're expected to live your daily life, go to school, compete, get to your job on time.
Function.
It's unbelievable.
And this is the conditions that you have to live in. It breaks my heart, actually.
Me too.
It breaks my heart.
Is this one of those things, though, that if a child has been affected by any of the diseases, that it would show up immediately, or is there any sort of delay in how they are affected?
Sure, that's a great question. I think it's going to depend on what actually the child or the person contracts. And remember that oftentimes it's either through direct handling or contact with the rat or the urine or feces or other dander, things like that. Symptoms could range from something like nausea, vomiting, allergic reactions, things like that, to more severe illness. And so to your point, some symptoms could be more immediate, some could be more longer term. So it's a range of things.
Not to mention PTSD.
Well, yes, and just not being able to sleep at night. Think about
that.
Yes.
Yes.
No, it's
the
quite,
parents
it's
feeling like they want to give you better.
Yeah.
It's horrible.
No, it is. It's sad.
All right. Well, hopefully something is being done for real.
I
and
really
it's not
hope
just
so.
a bunch of
diplomatic
red tape nonsense. Okay, so pain after childbirth could be a significant risk for postpartum depression. We were just talking about this during the break.
Yeah.
This is a very interesting possible linkage.
I think it is, and I think, as we were talking during the break, one of the most important things here is just raising awareness about postpartum depression. But the backstory is we've often linked pain during childbirth to postpartum depression. But we haven't really looked at where that pain was occurring. And this was a study, looked at over 4,000 women and asked them when your pain was and how bad was it and how was your mood. And it turned out that the women who had bad pain after giving childbirth also had the highest rates of postpartum depression. So there's this connection that perhaps, pain after giving birth may be a risk factor for postpartum depression. Either way, it's a wake-up call to, for women out there. This occurs in 1 in 9 women, postpartum depression. So it's very important to think about it as a whole.
Absolutely.
Well, it's interesting because it takes out of the equation how you actually gave birth.
Well,
we often hear about C-section or vaginal delivery or something like that, but this pulls that away.
Well, in some ways yes, in some ways no, because the women that were evaluated, they had C-sections and vaginal deliveries, etc. But you're right that there's a bigger question of why exactly did the woman have pain, and were there other factors that relate to that could have contributed to the postpartum depression. So that's a lot of mumbo jumbo that has to do with how studies are done and what we can really draw from them. But the idea here is there possibly a link between postpartum pain and postpartum depression? There might be. I think the biggest thing for us all is often remembering that, for any woman out there that's just given birth and maybe you're feeling sad or disconnected with your child or angry or just not feeling like you can care for your child, think about postpartum depression and think about getting help. That's one of the biggest things I think that we can stress to women out there.
Right.
Yeah.
And if you're a spouse of somebody,
absolutely
check in on that.
That's right.
Too.
Maybe a spouse is watching the show and saying, hey, I think this might be close to home, and may be able to act.
All right, Dr. Jennifer Caudle, we appreciate it.
Thank
Always
you.
a pleasure.